Hi guys. So I'm finally getting to record this. I had to record it. This is the third time. It was an issue with my charger, so I finally got it. I did have an extra computer, but the only one that had the files was this one. So that's why I couldn't upload it before. So I apologize for that. Reminder that I did extend the deadline for your initial discussion post to Thursday. Okay. So anyways, I'm going to set a timer here for 12 minutes with this PowerPoint and 12 minutes on sexually transmitted diseases, because I do think they're very important, so I don't want to miss it, okay? Let me just set my timer so that I don't go over. I don't want to take too much of the time, okay? Okay. Okay, so reproductive system, female reproductive system. Let's get started. Okay. So the external genitalia and vagina. Okay, let's talk about the external parts of the female reproductive system. The perineum, it's the same thing as in the male, but in this case, it's not the space between the scrotum and the anus, but the space between the vagina and the anus. Okay, that's the place that has to be cut sometimes during childbirth, because sometimes the head of the baby is too large. When babies are too big, they have to make an incision there. That's the proper word, make an incision, and then close it up again so that the baby, can be born successfully. The vulva, what are their structures? The vulva is basically the outside genitalia, okay? It consists of the mons pubis, which is right here, and it's called mons pubis. Mons means mountain, and pubis refers to the pubic bone. So this is the part in front of the pubic bone that has pubic hair, okay? Labia minora and labia majora, okay? It's right here. The labius, the labium majus, it's one. Labia majora is when it's referring to both sides, right and left, okay? So the labium majus encloses the labium minus, okay? Or the labia majora encloses the labia minora, okay? Then the clitoris, which is right here, okay? The clitoris is the equivalent to the glans in the case of, or the head of the penis in the men, okay? They're structurally basically the same, okay? But obviously much smaller in a woman, okay? The vestibule is right here, okay? And that's basically the entrance to the vaginal canal. The vagina, its functions are to discharge menstrual fluid, to receive the penis and semen, and to deliver a baby. Definition of these words: minora means smaller, okay? And that one's clearly from Latin. Minora, menor. Majora, mayor, it means greater. Labium, obviously also from Latin. Labium means lip, okay? And the plural is labia. Hymen means membrane, and hymen, what is it? I don't know if you've heard of it. That's the one that you supposedly breaks when you lose your virginity, or women do, or when the first time they have sexual intercourse. The thing is, some women are born without one. That's one thing. Thing number two, some women have sexual intercourse multiple times, and the hymen is still intact, okay, because it's very strong. Some women lose it while riding a horse. Some women lose it because they fell. So it depends on the woman, okay? So it's not a standard thing. Mons means mountain, and that's what's referring to the mons pubis. The vagina connects the uterus to the vulva. The uterus is where the baby grows. The urethra is embedded in its anterior wall, and the urethra carries urine, okay? And the functions of the vagina, we already discussed them, okay? Now, word analysis definition, fornix. Fornix means vault, and what fornix is, it's an arch-shaped, blind-ended part of the vagina behind and around the cervix, and I'll show it to you in a bit, okay? So basically, the last part of the vagina right before the cervix. The mons means like I said, mountain, and pubis means referring to the pubic bone, and I already explained what that is. Vagina means sheath, and sheath basically means a cover, okay? Something that encases something else, but that is made of light tissue, okay? So the vagina is the female genital canal extending from the uterus to the vulva, okay? The vulva means a wrapper or covering, so it has a similar meaning to sheath, okay? And the vulva is the female external genitalia. But what it's basically covering is basically the internal organs, okay? Then the plural forms of this. The plural of labium is labia, plural of majus, majora, the minus, minora, and fornix, fornices, okay? The following words need to be changed to adjective form. Cervix. Cervix becomes cervical, and you've heard probably cervical cancer. And so the cervix is the neck of the uterus, okay? Ovary becomes ovarian. Vagina becomes vaginal. The vagina is a female genital canal. Vulva becomes vulvar. And vulva is a term for the external female genitalia. Disorders of the vulva and vagina. Okay, you can have bacteriovaginosis, which is an inflammation of the vagina causing a strong fish-like odor. It is caused by bacteria and treated with antibiotics. Okay, now bacteriovaginosis typically happens because there's contamination from the anus to the vagina. That can happen because it can happen in little girls because they wipe from the front to the back, and they don't, they bring bacteria from the back to the front. It can happen because of poor hygiene, of course, and it can happen because of sexual intercourse, okay? The bacteria just, there's all this movement and the bacteria sneaks in the vagina and then it causes a problem, okay? Typically, the bacteria that causes bacteriovaginosis is E. coli, and E. coli is perfectly fine in the digestive system, but once you put E. coli in a wound or in the vagina or anywhere else, it causes disease, okay? Toxic shock syndrome is life-threatening or can be life-threatening, and it's caused by toxins in your bloodstream, okay? Typically, used to be caused, now they're making tampons safer, but it was commonly caused by super absorbent tampons that were left for too long. Vulvovaginal candidiasis is typically known as a yeast infection, and it's typically caused by taking antibiotics. And you're like, why do you get sick from taking antibiotics? What happens is that antibiotics kill everything. Okay, so it kills your good bacteria and your bad bacteria, okay? And so we have good bacteria that actually protect us, and that's what happens in this case, okay? Something that I recommend that is known to help is while you're taking antibiotics, you should be taking probiotics, okay? Which basically keep that normal flora or that normal bacteria healthy, okay? Also, eating yogurt also helps keeping your bacteria down there healthy. Vulvovaginitis, can be caused by allergic reaction and irritative agents found in vaginal products. You're not supposed to be putting perfumes or using those douche bags because they can cause infection unless your doctor specifically tells you, okay? A lot of people use that douche bag word and don't even know what it means, but that's what it is. It's a wash for the vagina, and it's not supposed to be used unless your doctor tells you specifically to use it, okay? Because it messes up the pH of the vagina. Vulvodynia, dynia means pain, and this is chronic severe pain around the vaginal orifice, sometimes causing dyspareunia, and dyspareunia means painful intercourse. Vaginal cancer is not very common, and if it does happen, it's treated the regular way as in any other type of cancer, surgery and radiation. The suffix in the following. Vaginosis, osis is the suffix, and it means condition, typically abnormal. So this is a condition in the vagina. Vaginitis, itis is inflammation, and we have vulvovaginitis, once inflammation of the vagina and once inflammation of the vagina and the vulva. Vestibulectomy, ectomy is a suffix, and it's surgical removal. In this case, it's surgical removal of the vulva, okay? Vulvovaginal, AO means pertaining to, so this is pertaining to the vagina and the vulva. Dyspareunia, as I said earlier, this is a prefix that means difficult or painful. Pareuon means sexual intercourse, and ia means condition, okay? And this is caused by this, okay? You have vulvodynia, which is pain in the vulva, so which prevents you from having healthy sexual intercourse. STDs, I'm going to skip it because I'm going to cover separately. There you go. And anatomy of the female reproductive tract. So this is on the inside or internal. You have your ovaries, your fallopian tubes, and your uterus. Here we can see some of the anatomy of the female reproductive system. You have your vaginal canal, vagina. You have the external os, and os means mouth, leading to a canal. You have your cervix right here. This is the famous cervix. And this canal right here in the cervix is what dilates to let the baby out when he's ready to come out, okay? The lateral fornix, that's the fornix that we were talking about, which is the end of the vagina, okay? The blind end of the vagina. Cervical canal right here, which the baby comes out through, this coming from the uterus. The endometrium, endo means inside, and endometrium refers to the inside layer of the uterus. Then you have the internal os, which is, again, mouth leading to a canal. The myometrium, my means muscle. So this is the muscular layer of the uterus, okay, that it contracts, okay, to allow the baby out, or when we have our period, it gives us cramps, okay. Then you can see the ovary here, the internal part of the ovary, the fimbriae, which is basically the last part of the fallopian tube. These are parts of the fallopian tube. You have the ampulla and the isthmus. This is the fundus, is the top part of the uterus. This is the body of the uterus, the ovarian ligament, okay, right here. The mesothelium, which is part of the ovary. The mesosalpinx, right here. The artery and vein, ovarian artery and ovarian vein, which provide blood supply. The fallopian tube, it's right here, enclosed in tissue, and here you can see it. The ovary, which produces your eggs or your ova, and the broad ligament. Fimbriae. Fimbria means French. Fimbriae is plural. Okay. The fimbriae is a French-like structure, and that's where the egg comes out of from the fallopian tube. Os, like I said, means mouth, and it's an opening to a canal. Ovum means egg, and the ovum is a female reproductive egg. Ova is the plural of ovum. Uterus means womb, and the uterus is what helps, it's where the fetus develops. The sexual cycle, real quick, is first, this is this is our sexual cycle, our reproductive cycle, okay? So first you form primary follicles here. Then you have your oocyte, which is basically an immature ovum. Then you have your secondary follicle with your oocyte still right here. Then you have here a mature follicle with the antrum, this structure right here, and the oocyte. Then you have ovulation, where the oocyte or the immature ovum gets released, and then it matures in the process. And then if fertilization doesn't happen, we get our periods, okay? Then you have your corpus luteum, which is basically the structure that is left after the ovum leaves, and eventually it just turns into the corpus albicans. The corpus luteum is important because it produces progesterone, and it helps maintain pregnancy. And this is basically, it's just gonna leave like a little mark, a little scar that eventually just disappears in the ovary, okay? And I'm gonna stop right there, and I'm moving to sexually transmitted diseases. I recommend that you still finish going through this if you need to learn more about the female reproductive system. Okay, so sexually transmitted diseases, real quick. Now, when thinking about sexual intercourse, you must always assume two things, pregnancy and that an STD can happen. The statistics show that 1 in every 4 people will contract an STD in their lifetime. Every day in America, about 10,000 teenagers catch a sexually transmitted disease, and teenagers is, less than 18 years old. Types of STDs based on symptoms. You have symptomatic and asymptomatic sexually transmitted diseases. So what this is saying is that some people show symptoms for the sexually transmitted disease and some people don't, or they get symptoms that may be confused with symptoms of something else, so they don't get treated, and that's when they probably pass it on, when they don't know they have it. Types of STDs based on transmission. You have fluid-based STDs, to which condoms, barrier contraceptives are highly effective, such as condoms. Examples of these STDs are chlamydia, gonorrhea, trichomonas, HIV, hepatitis B and C. And then you have STDs that are transmitted through skin-to-skin contact. In this case, no protection is safe other than abstinence. Herpes lives on the skin, syphilis on the chancre stage, and I'll talk about the stages right now, the first stage. Genital warts or human papillomavirus, which thank God there's a vaccine for it. So please, if you haven't gotten it, please get it. Both boys or girls, gentlemen, ladies, please get it, okay? Because it's so prevalent right now, and it causes cervical cancer, but I'll talk about that right now. Okay, pelvic inflammatory disease. Pelvic inflammatory disease is an inflammation due to infection that occurs in the uterus and fallopian tubes, okay? It can be caused by diseases, untreated diseases such as trichomonas vaginalis, chlamydia, or gonorrhea, okay? What happens is that the tissue in the uterus gets so inflamed that it starts becoming scar tissue, and then eventually the woman becomes sterile from the STD that went untreated for so long, okay? The reason why people don't get treated is because the symptoms may be confused with other symptoms, such as fever, some discharge, painful intercourse, painful urination, irregular menstrual bleeding. So you may think you have, something hormonal going on or a UTI, just attribute it to something else and you don't get checked. That's why it's very, very important that if you are sexually active, you go get checked, okay? Once a year, I guess is enough. Depends on how sexually active you are, I guess. But yes, get checked, that's the point. Chlamydia. It's caused by chlamydia bacteria. So anytime you hear bacteria, that's good news because it can be treated with antibiotic, okay? The symptoms in the male are burning when they urinate and some discharge. The female, it's usually asymptomatic. Sometimes they may have that vaginal discharge, but sometimes they just don't have any symptoms. The problem is that if they get chlamydia and they don't get treated, they can end up with having, they end up sterile from pelvic inflammatory disease. It affects your uterus, fallopian tubes, and your vocal cords if you are involved in oral sex. So you can end up with chlamydia in your vocal cords as well. This is just me looking back because a lot of people, they look clean, but that has nothing really to do with sexual genital diseases sometimes. Gonorrhea. Gonorrhea is caused also by a bacteria, gonococcus bacteria, which is a good news because antibiotic. The symptoms in the male, it's that they get a greenish yellow discharge from the penis, and they get burning sensation, very strong burning sensation when you urinate. It used to be known as the razor blade disease because it was that painful. Men described it as peeing razor blades. Sore throat and swollen glands. The female is usually asymptomatic, so the female is typically the one that passes it around, carries it, and just doesn't know. If they do show symptoms, they may show dysuria, which is difficult, painful urination, some abdominal pain, and some discharge, which again can be attributed to something else. If they don't treat it, though, they can end up sterile from pelvic inflammatory disease. It affects the uterus, fallopian tubes, and you can also end up with gonorrhea in your vocal cords resulting from oral sex. Now, most women get prenatal care nowadays, but if a woman, typically this happens in third world countries, if a baby is born to a mother, to an untreated mother that has gonorrhea, the baby will probably be permanently blind, okay? The cure is antibiotics, very simple. That's just an image of razor blade disease. Statistics, what do they show? In chlamydia, 30% of the cases of chlamydia are between the ages of 15 and 19. And then the biggest group is college age. Okay, so watch out in college, guys. In this one, gonorrhea, again, 25% are teenagers, young adults, and the biggest group are the college age. Okay, and then people start, I guess, taking care of themselves afterwards. But there's still cases, over here. HIV, there's between 13 and 24 years of age, 23%. Then you have the 25 to 34 years old, which are young adults, 28%. That's the highest, young adults. And then you have 35 to 22%. It's good. It decreases also with age. Hepatitis B is caused by a virus, okay? What does it cause? Appetite loss, fatigue, nausea, vomit, itching, pain over the liver, jaundice, dark urine, pale stool. And if they don't treat it, it can get to the brain, causes mental disturbance and collapse from fatigue and abdominal swelling. It affects the liver, and if it's untreated, it eventually affects all your organs. There's no cure for hepatitis B, but there's a vaccine available. So they're required for anybody that wants to go into the health field. So just make sure that you have your hepatitis B because it's a series of 3 shots. Hepatitis C. Hepatitis C, also caused by a virus. So you kind of like, once you have it, it's always there in your system. What does it cause? Appetite loss, fatigue, nausea, vomit, diarrhea, pain over your liver, jaundice, dark urine, and pale stools. It affects your liver, and if you don't treat it, it affects all your organs, which can result in chronic hepatitis, and it can result in cirrhosis, liver failure, and death. 4 million people are infected with virus in the U.S. There's no cure available, and there's an update to this. There is a vaccine available now. I saw it on TV. I don't know how available it is. I will need to check, but I know it's out there. AIDS. AIDS is the name of the disease. HIV is the name of the virus. Okay. There's 3 stages to AIDS. The first one is fever, headache, so like enlarged lymph glands. So you get a flu-like symptoms, and then that goes away. The issue here is that you have HIV and you think you got the flu, and then you get over it and you keep passing it on for sometimes, like it says here, months or years. Sometimes the second stage doesn't show up for that long. The second stage is obviously you are very sick, tiredness, weight loss, fever, sweats, frequent yeast infections, persistent skin rash, flaky skin, short-term memory loss, mouth, genital, and anal sores from herpes. Because remember, HIV basically shuts your immune system down, and so you pick up anything, your immune system is not working. The third stage is terminal, shortness of breath, seizures, painful swallowing, so people can't even eat, mental disorders, nonstop diarrhea, fever, vision loss, nausea, abdominal cramps, vomiting, weight loss, extreme fatigue, severe headaches, cancers, and it affects all the organ there. And there's, to this day, there's no cure for AIDS. There has been no rare cases that, I don't know, they get some sort of course, this is, for example, Magic Johnson, the basketball player, he had AIDS and he's fine. So, but I've never really done the research on what treatments he got, but of course he's a millionaire. So he probably had access to the best of the best all over the world. So anyways, every 9.5 minutes, someone in the US gets infected with HIV. So that's pretty scary. Global view of HIV, it's obviously worse in third world countries. Okay, Africa is pretty bad with HIV still. The US, lifetime risk of the HIV diagnosis by state, the South is pretty bad. So I guess the South, people in the South, the statistics show, are typically, there's less education about this because they're very conservative. So there's no sexual education, and there's ignorance a lot of times. So people, they don't use protection, they don't get checked. You know, they think getting checked or Planned Parenthood is from the devil. So all these things prevent people from getting the care that they need. But anyway, so yeah, this is not good. Syphilis is caused by bacteria, so that's good news. It can be treated by antibiotics. It is not very prevalent in the US anymore, but it is prevalent in third world countries. The first stage is a chancre, which is a round lesion in the general area that disappears. And then the second stage is a rash, sore throat, swollen glands. Symptoms disappear in a few weeks. The third stage it's really bad. It causes cardiovascular disease, paralysis, mental disorders, blindness, and deafness. First and second stage, you can still get antibiotics. If it gets to the third stage, then there's no cure. Trichomonas vaginalis is a parasite. The male has no symptoms. In this case, it's the male that just passes it on and doesn't know. It lives in the male urethra. The female gets large amounts of white, yellow, foul-smelling discharge. And remember this one, if it doesn't get treated, it results in pelvic inflammatory disease, which can result in sterility. It affects the vagina and the vulva. It lives in the male urethra, and the cure is flagyl. Okay. I believe it causes itching also, but don't quote me on that. So the female will know that they have it. Pubic lice. Pubic lice are commonly known as crabs. It is called by lice, but lice down there. It causes intense itching in that area. It affects the outside genitalia. Of course, lice clean medication. It's easily found, can easily be prescribed. And of course, the other thing is lice gets attached to hair, so you can also take care of the hair and probably will take care of the lice. Okay. Genital herpes. Herpes has no cure. It has treatment, but it has no cure. Okay. The symptoms, you get burning, fluid-filled vesicles or blisters that rupture, and then they form ulcers. all in the genital area. So they're very painful. Now, these sores heal and then there's nothing there. So this is when it's people transmit it, especially if they don't get treated, because it just comes and goes. It affects the outer genitalia, and you can end up with herpes in your vocal cords from oral sex. Okay. There's no cure. If the baby transmits it to the, if the mother transmits it to the baby, I'm sorry, the baby will die. Okay. The lemon story. The lemon story, just real quick. It used to be they used to, back in the day, soldiers used to go to prostitutes and they would carry a lemon and put lemon on the privates, and they would say that if the prostitute showed pain, that then they were infected, but if not, they were clean. But obviously that only applies to herpes that are active, not when it's inactive, or for syphilis when it's on the chancre stage, but it doesn't apply to all STDs or the stages where it's dormant. So it's just ignorance. HPV, or genital warts. It causes warts, itching, discharge, bleeding, urine obstruction if the warts can block the urethra or the anus. And the main thing is it can cause cervical cancer. That's why it's so important to get checkups. For women, you're supposed to get checkups once you start your period, actually. But even if you don't do it then for sure when you're sexually active, you should be getting those checkups, okay? It affects the mouth, can affect the mouth, the anus, hands, the cervix, the vulva, the penis, and the urethra. Now, there's two types of warts. You have the HPV that happens in other places of the body, and then you have genital warts. Okay, they would have to test it to identify it. There's no cure for these. There's treatment. They can burn them with laser if they're like very visible, or they're blocking anything, but they come back. There's a vaccine available, but the vaccine is only available to women under the age of 27. After that, they won't give it to you because they say you're probably already exposed. So it's available for women and now for men. So make sure that you ask your pediatrician, ask your doctor to give it to you, okay? Because it'll prevent you from, women from getting cervical cancer, probably, or just warts, and men from passing it to other women, okay? There's approximately 79 million people infected in the US, and 14 million more people get infected every year. So it's very, very prevalent. This is the prevalence of HPV. Again, college right here. Anyways, but it also affects high school, okay? High school age, young adults. Common sex and STD myths, that's just for your knowledge. These are all lies. You only get STDs from slutty girls and dirty guys who sleep around. No, this can happen to anybody, okay? 2 condoms are better than 1. No, never do that, because one will rip the other one. So no, don't do that. You can use any plastic bag if there's no condom available. No, guys, do not use HEV bags, Ziploc bags, or anything like that. It does not. Plastics have microscopic pores through which bacteria, viruses, or sperm can go through, so not reliable. Condoms protect you against all STDs? No. Remember, we said it doesn't protect you to diseases that are skin-to-skin transmission, like herpes, syphilis on the first stage, or human papillomavirus or genital warts. If you pull out, the girl won't get pregnant. That's also a lie, because there's something called pre-ejaculation, which releases some sperm, so some women get pregnant, even then, especially if they're ovulating. If you jump right after sex, the sperm will come out and you won't get pregnant. No, lie. No, that does not work. The sperm travel through the vaginal fluid, so it doesn't, gravity does not affect. If you had sex in a tub, pool, or shower, the sperm will die and you won't get pregnant. No, that's a lie too, okay? Because again, the sperm travels through the vaginal fluids, and the water doesn't go in there, okay? It has a mechanism where like the water doesn't go in there. If not, every time women will get into a pool or a bathtub, they would like get full of water inside, and that does not happen. So that's why this doesn't make sense. You don't get STDs from oral sex or anal sex, and we already saw that on the facts. Yes, you do, from both. If you douche right after sex, the sperm will rinse out and you won't get pregnant. No, that's also Not true. You can have an abortion or take the morning after pill or the Plan B pill many times and nothing happens. No, because again, this the abortion is a surgical procedure. And the morning after pill, it affects your hormones. It makes you kind of get your period. So it's not right to be like messing with your hormones all the time. Okay, so don't fall for all those. And then the last one, there's no risk of pregnancy if you miss a contraceptive. If people are taking the pill, women, yes. And I know of cases that they missed the pill one day, or they started the next set of pills a day late and they got pregnant. I know 2 people actually that got pregnant like that. So don't trust that. And that's it, guys. Sorry, I went like a few minutes over, but I really wanted to cover this because it's important and I want you to know. Anyways, bye. Make sure you take your notes and complete your discussion.